Shock to Gino Kenny.
Margaret, Minister, I just want to first to acknowledge all the work, the really good work that all our health care workers do in the front line, our health service, and you know, we rely on them so much in relation to our own care and everybody else's care. And I think, you know, overall, and I've said this many times, I'm very critical of the inequalities in our health system, but once you get into the system, the public system, it's a very, very good system. You know, you're treated very, very well, and as best as you can in that environment. And I think that's something to be very proud of in relation to our own country. But there is historical inequalities in relation to getting that access, in relation to waiting lists and so forth. And I think, you know, that is I suppose, the job of the government and job of the successful governments in relation to meeting that. But there is gross inequalities, I would say, in relation to access. And I think of the shortfalls in the budget, there will be a consequence in relation to those that rely on services. And given that there's going to be an embargo on certain professions, I think that will have consequences across the board. Just, Minister, I want to just focus on one issue in relation to the budget, and I spoke to you kind of informally about this, and I think it's a very serious matter, and maybe you can throw some light on it, is in relation to access to life-saving medicines. Now, obviously, normally there is a budget in relation to these medications and treatments, but that budget now has been basically cancelled to a certain degree, and obviously a lot of patients rely on certain medications and treatments. I mean, there's 1,000 cancer patients that should get access to 23 new medicines. Now, they may not get them. So I just wonder, could you bring clarity in relation to that issue? Because that is a life and death issue. That's an issue whether, you know, somebody can get treatment or not. I got an email, like all the other TDs in here, in relation to a person that was one of these patients, and they were told they will not get access to this new drug, and they will have to leave the jurisdiction to get access to that drug. Now, that's not good enough, you know, because in the situation they are kind of relying on this drug in relation to their intervention. And even Bernard Gloucester has said the lack, you know, because this will have a significant slowdown as a result of the lack of additional funding for clinical programmes. So this is quite serious, Minister, to say the least. So I'd be very grateful if you could bring some clarity in relation to the shortfalls in relation to particularly these new drugs and treatments and the funding. And I think even obviously for us, we're obviously the people that rely on these new treatments and drugs. And there is more than 1,000. There's 4,000, in fact, and more in relation to her waiting for these drugs. So I'd be very, very, very grateful if you could bring some sort of clarity in relation to this. Thanks.